Well, I consider myself an obesity specialist. I am board certified in bariatric surgery, and I also am board certified in obesity medicine. And obesity today is no longer a US problem, but it's a global problem, and it's now affecting our children. It's actually the third most common cause of death among the lifestyle diseases. And recently, the World Health Organization stated that it's tripled its prevalence since 1975. That's such a short amount of time. So that makes obesity the fastest growing disease known currently, and it is the cause of so many different medical conditions. Over 257 medical conditions has been linked to being obese, as well as 40% of cancers. So it's a real problem. Well, I feel like my view is unique in treating this disease because I treat obesity and see healthcare kind of different than the way I see everything else and the way other people treat it. So in general, medicine and the way I was taught as a physician is to understand the disease, identify the disease, and then treat the disease. But in general, I think we should understand the disease but identify the contributors to the disease and then treat the person. So in my program, Neuro Switch Weight Loss, I do just that. I do a combination of genetics because I think that's a foundational root cause of obesity, and I look for the root causes. And I also do kind of a different approach. It's called a neurobehavioral approach backed by neuroscience, and that's the way I treat obesity as a foundation. I think all the other tools that are out there, medications, diet, exercises, and even surgeries is a great tool, but the foundational piece to treating obesity is rooted in both genetics and neuroscience, and that is my unique perspective on how I treat obesity. So the name of my book is Transformation is a Mindset, and changing your input will literally change your world. And that was the name of my book. And the motivation behind that was actually my patients. And seeing patients on the operating room table a second or third time getting a bariatric surgery for weight regain, I knew there was a missing piece. And so I learned traditional medicine. I went through traditional medical diploma. I did my general surgery residency and then subsequently did a fellowship in obesity medicine. And I was taught in school that surgery was like the best treatment for obesity. And this is what I thought for years until I found patients who underwent the surgery, what I would call the Taj Mahal of all surgeries, and subsequently still regained the weight. And it wasn't necessarily because the surgery, something that was wrong with the surgery. A lot of my patients that regained the weight, they went back to their old habits. I noticed it was like a psychological problem. It was a mindset problem. And so in learning from my patients, they inspired me to write the book because I wanted to help them understand that it's a mindset. And once they can transform that, they can truly overcome their struggle with obesity. I am excited because I truly feel like I found the missing link to treating obesity and helping patients to overcome obesity. And I hope to be able to teach this to providers also. I'm excited about the future of obesity medicine because there are so many different tools that are out there now. And I truly think the combination of genetics and neuroscience and what I've put together in NeuroSwitch can truly change the trajectory of obesity and help so many patients who struggle, and in turn teach this to providers and the next level of generation that are going to be treating this disease, in hopes by treating obesity we can also combat all the other 257 known medical conditions that obesity causes. So that is super exciting to be able to treat all of those diseases with just one mechanism in NeuroSwitch. Well, I think one of the biggest discoveries that's coming out now is that obesity is truly a neurodevelopmental disease. Years ago, everybody thought it was just purely calories in, calories out. We all kind of, unfortunately, blamed the person who was struggling with obesity. We thought it was their fault. They couldn't eat less enough, they ate too much sugar, they didn't work out. But now we are realizing that obesity is a chronic multifactorial disease that has so many different roots. And one of the biggest things that we are noticing is that literally literally the brain changes. We have seen this on MRI studies with people who struggle with obesity. Different environmental cues will trigger different areas in the brain differently than somebody who does not struggle with obesity. So in finding these things out is that obesity is truly a neurodevelopmental disease that requires a neurobehavioral approach in order to kind of rewire these neural connections, much like all the work they did in addiction medicine. I discovered that the world needed this program, Neuro Switch Weight Loss, which is why I kind of rebranded and recreated it when I started seeing obesity continue to rise after decades and decades. It is now, like I said, not just a US problem, which it used to be, but it's a global problem. It is now affecting our children, and we are now having conferences on obesity pediatrics because this has now become a problem in the children. And so in seeing this continued rise of obesity and seeing the amount of decrease of quality of life and all these other medical conditions that can be triggered if you have obesity, and especially even during COVID, we saw kind of what that did for patients who had COVID and obesity. It's time to be able to stop this epidemic from getting worse and start reversing the obesity epidemic. And that's why I created NeuroSwitch. So I've been working in the obesity field for about 12 years now, and a lot of things have changed. So the surgeries have changed, there's newer medications out, that has changed. Even my perspective has changed, and that changed because I would see patients who've already had a previous bariatric surgery, and then they would regain, and they would end up on the operating table a second or even third time. And this is what I thought, there has to be something different. I was taught that surgery was the most sustainable, and studies have shown that it is, but there is a missing link still. And I think that is the neurobehavioral aspect, the neurodevelopmental aspect. And so for me, for sure, that's one of the things that has changed. Discovering all the different dynamics to obesity and all the different contributors, that it's not just calories in, calories out. We don't blame the patient. It's not to shame and blame the patient anymore. There's really so many different things at stake. It's where they lived, how they grew up, deprivation, were they in poverty, discrimination. There's so many different studies coming out now that contribute to specifically obesity, but several other chronic diseases that we are learning now. And so therefore, the treatments need to be different. It can no longer be, here's a medication, here's a diet plan in order to treat that disease. That's the biggest difference that I think I've seen. And that's most recent in the past couple years.